Hello there, IEEE VR. My name is Emil, and I'm here to present our work, Keep It Clean, about the current state of hygiene and disinfection research and practices for immersive virtual reality experiences. I think this conference really demonstrates the benefits that VR have on many different domains. The interdisciplinarity of the conference, the many different workshops and presentations we've seen, education, healthcare, sonic interaction, archaeology, just to mention a few. With all those different fields, share is virtual reality. And when virtual reality is shared among people, there's a risk. And that's what I'm going to talk about today. Not cyber sickness, not ergonomics, but one that surprisingly have not seen extensive research. The 2020 COVID pandemic changed the landscape of many scientific fields, including virtual reality. And with it, it also opened up a market for hygiene methods specifically targeted virtual reality. But to be fair, many of these solutions existed way before COVID, but it certainly sparked an interest and demand for such solutions. Which solutions? State-of-the-art hygiene products cover many different commercial available solutions, including physical barriers that prevent contamination, but also cleaning and disinfection agents. Some of these are deliberately developed for virtual reality, while others are established methods used in medicine, such as alcohol and antibacterial wipes. We can also see an increase in other products, for example, UVC light, which have existed for hundreds of years, also specifically being targeted for commercial use for VR devices. But alcohol and antibacterial wipes have been used for many years as an established method in within healthcare. And another emerging method is dry chlorine gas, which has been used to sort of disinfect within areas where it cannot be reached. But what does the research say? Well, it's scarce. Both that and also clinical recommendations for safe use does not really appear to be readily available, and the ones that are often does so with another motive of selling a product, but the product had not necessarily been clinically proven to work. And the risk of contamination is real. One research study from 2020 showed that VR headsets subjected to extended use in a lab setting colonized by high levels of bacterial contamination that are equivalent to that of computer keyboards or other similar public lab settings. So given the scarcity of research and the availability of many commercial solutions which have not necessarily been demonstrated to work, we set out to investigate. Aim 1 was to survey a range of stakeholders that uses VR technology in multiple domains, for example, education and training, therapy and rehabilitation, entertainment and research, with the purpose of exploring the range of common hygiene practices. And the second aim was, based on the research and the responses in the survey, to review the advantages and disadvantages of current state-of-the-art hygiene solutions and to identify future research directions and opportunities for our field. And since no similar research has been done before, and due to the descriptive nature of our inquiry, we devised ourselves a survey and evaluated it internally, and the results were analyzed per content analysis approach. And due to the descriptive nature of the survey, a comprehensive content validity was not undertaken. Our survey gathered a total of 42 respondents from many different countries, mostly from Denmark, but it also included a total amount of weekly users around 500, a minimum of one weekly users up to a maximum of 300 weekly users. And the populations in question were school children, medical students, nurses, doctors, older adults, and patients with multiple diagnoses, including stroke. We did not manage to gather an equal amount of users across all fields. The two most predominant fields were education and training and therapy and rehabilitation, and then research, and only 2 respondents from entertainment industry. Hygiene methods varied across all the fields, But most popular across all of them was antibacterial wipes and alcoholic wipes, but also a combination of wipes and permanent face covers worked in tandem. Funnily enough, UVC light was more popular in education and training than it was in therapy and rehabilitation. And the most popular devices used across all the fields were the Oculus Quest or Pico. Pico was more popular in health and rehabilitation than it was in education, where the Oculus Quest or other standalone headsets were more favored. A majority of the respondents had confidence in their protocols that they used, and 64% expressed no concerns regarding the cleaning protocols. The concerns that they had centered more around the actual adherence of the protocol. Did the users actually adhere to the protocol setup? Did the cushion get cleaned? And did the headsets actually, did they keep track with which headsets has been cleaned when? And one user from Denmark said that the only concern that they had was sometimes that they forget to clean the headset. Moving on to the review results. The literature on VR hygiene is very short. I'm just going to leave it here and you can pause this video and check out some of these papers yourself, and I'm going to move on to the synthesis of it. That's where we get to discuss the advantages and disadvantages of these solutions, both based on the reviews and from the survey. So the most popular method was the alcohol or antibacterial wipes, and that was most popular across all the domains. From the study from Roberts, they did a sample of 175 different VR headset samples of contaminating them and sampling the efficacy, and they reached an 88% efficacy of virtual reality headsets using alcohol and antibacterial wipes. But the bacterial count was quite different between the non-porous surfaces and the porous surfaces, with an almost 80% increase in bacterial count in the porous surfaces of the headset. Made of acrylic material, which is very susceptible to alcohol. And alcohol may dissolve the polymer chains and lead to what's called a stress corrosion cracking. So that is why they recommend that you do not use alcohol for the lenses. What I talked about before is that the porous surfaces, which is a darling in the industry, that really use it because it's very comfortable. But as you can see, there's close to a 200% increase in bacterial count on porous surfaces of the headset, based on Roberts' investigation. Barriers such as silicone covers or replaceable covers that you wear in the headset or on the face. And in our research, they were often used together with the other cleaning agents. And it serves as a good replacement because it replaces the porous surfaces. But it does not prevent hand-to-headset contact, because as you can see from this next image, you have a lot of touch points on the outer side of the headset, knobs and buttons that you touch. So if you don't have proper hand hygiene, you're going to transfer or risk transferring cross-contamination from your hands to the headset. 100 years of research, and it's very much used in food industry. It works with either LED or fluorescent lights, but the cost is very, very high for these devices. It's worth noting that there are missing standards on how to evaluate the efficacy of these devices, which is a concern shared by the International UV Association. And the exposure is carcinogenic, that there are devices that you use outside the shielding, which is very, very dangerous to use. You should not use those. And the efficacy depends on many different factors, including exposure time, lamp placement, and air movement patterns, and air humidity. Device manufacturers should really stop using porous materials in their design and supply materials that can withstand cleaning agents. Researchers really need to start investigating the comparative efficacy of these cleaning methods and the risk assessment in different contexts. And governing agents like FDA should really introduce certificates for producers UVC devices and supply guidelines for safe use. And users and organizations should make device protocols and materials for new staff to increase adherence. There are many different research opportunities both within basic research and applied research, because this field is really truly undersaturated. We need to work together in order to advance this field, because it's highly needed. Thank you very much. Don't hesitate to reach out if you have any questions.